Good afternoon, everyone. This is Kathleen O'Dowd with American University's Online Masters in Nutrition Education program. I'm really excited to have everyone in attendance today. We have a great session planned. Before we get into the presentation, I'd like to go over some introductory information just to get everyone acclimated to our platform that we're using. So the webinar is muted. So the interface that you'll have with us is typing in questions in the GoToMeeting dashboard. So feel free to type in any questions you have throughout the presentation. And at the end of the presentation, we'll have a Q&A session where we'll open up questions to the audience. So let's go ahead and get started. The topic of today's webinar is the impact of COVID-19 on food insecurity across the U.S. We are fortunate to have the program director of the Nutrition Education Program on the call with us today, Dr. Stacy Snelling, as well as two very special guests, Johanna Elsmore, who's an alumni of the program, and Monica Hickey. We are excited to have many of our students, alumni, and prospective students as well with us today. And as mentioned earlier, we do encourage participation. So please type questions, comments that you have, and we'll go over those at the end of the presentation as time permits. Our agenda for today's session is as follows. We'll first introduce our speakers, then we'll move on to the main topic of our session today, and we'll hear from our special guest speakers and the work that they do. Dr. Snelling will then kick off the Q&A session, and we'll open up questions to the audience. And at the end of the presentation, I will quickly run through the admissions process and also announce the featured speaker for our next program webinar. So be sure to stick around to the end. So without further ado, I'll introduce Dr. Snelling. So Dr. Snelling is a professor, the chair of the Department of Health Studies, and also serves as the program director for the Masters of Science in Nutrition Education and the Masters in Health Promotion Management online programs. Her research focuses on methods of behavior change in nutrition education to manage risk factors related to chronic disease. She's written over 50 articles, book chapters, and other publications, as well as presented over 100 speeches to regional, national, and international audiences. Welcome, Dr. Snelling, and thank you for being here today.
Great. Thanks so much, Kat. And the Department of Health Studies is so pleased to bring you this webinar with two outstanding speakers from national organizations, Feeding America and Share Our Strength. The U.S. is facing an urgent health issue, food insecurity exacerbated by COVID-19. In recent months, food inequities have been laid bare as never before due to a myriad of issues. It is a highly complex issue for which there are many causes and will require many solutions for months and possibly years to follow. Food insecurity does cut across age, race, and ethnicity. However, there is an overrepresentation of people of color, and in particular of Black people, among the food insecure population. And this is an extension of the many inequities that result from numerous long-standing systemic injustices. Students at American University, and in particular those in the Department of Health Studies, who are dedicated to nutrition education, public health, and health promotion, are committed to addressing social justice issues. I'm proud to say that AU has some of the most engaged, socially minded students across the country, and they will be the future leaders of addressing health and food equity. I'd like to acknowledge the tireless work of the Healthy Schools, Healthy Communities team, who are promoting nutrition education and food access in Washington, D.C. With our partners, D.C. Central Kitchen, D.C. Public Schools, and D.C. Department of Health, we're proud of the work we have done and continue to do to address food equity. But today we're going to hear from Monica Hickey and Johanna Elsmore, who will share with us a national perspective of the crisis, how many people are going hungry, the need for emergency food, and the strategies being employed to address food insecurity. I will introduce both speakers and then I'm going to kick it off to Monica. So Monica is the Senior Research Manager at Feeding America. She focuses on conducting research, curating knowledge, and disseminating actionable insights about domestic food insecurity and nutrition assistance programs. She holds a BS in International Business and Accounting from Marquette University and an MSW from the University of Illinois in Chicago. Johanna is the Media and Public Affairs Manager for No Kid Hungry, a campaign of the national anti-hunger nonprofit Share Our Strength. She did receive her master's in nutrition education from American University, where she focused on food justice and health communications. While here, I had the pleasure of working with her and collaborating on writing a published piece on food insecurity on college campuses. She's a passionate foodie, self-taught chef, and a triathlete, living in Washington, D.C. with her husband and her 2 pit bulls, who are in the background today. So I'm going to hand it over to you, Monica, to get us kicked off.
Great. Thank you so much, Dr. Snelling. It's a pleasure to be here. Let's see if I can move this to see the slide. So as Dr. Snelling said, my name is Monica Hickey. I'm a manager at Feeding America and really excited to be here today to share a little bit more about my organization, the work we're doing, and the issue of food insecurity, especially related to the pandemic that's emerged this year. So looking at the contents of what I'm going to cover, I'm going to start by giving a little bit of information about Feeding America, talking specifically about what food insecurity is, giving some background and a little bit of the contextual aspect of that from a research perspective. Talk next about how COVID-19 is impacting food insecurity, especially in 2020. Discuss the charitable response specific to how Feeding America has been addressing the issue, and then conclude with a call to action. So moving to the next slide, like I said, I'm going to give a little bit about Feeding America. So onto that, the slide afterwards. Feeding America is a national network of 200 food banks across the country. We have one national organization that's located largely in Chicago with an office in DC and then other staff spread across the country. And there are 60,000 food programs that are part of our food bank networks, like pantries and soup kitchens. And together, every year we typically serve about 40 million people, although that is before the pandemic. On to the next slide, the mission of Feeding America is to feed America's hungry through a nationwide network of member food banks and engage our country in the fight to end hunger. So this means that we're providing food to people who need it today, while also advocating for policies and programs that will support people facing hunger, as well as working to address the root causes of hunger as well. On the next slide, we've got a map of our food bank network. So each of those dots represent one of our 200 food banks. So you'll see they're spread across the country. And collectively, they each have their own service area and together serve every county in the United States as well as Puerto Rico. On the next slide, I've got a little bit of a visual in terms of how we work. Food banks were created back in the day to connect excess food in communities with people who need it. And so from a high level, they work with suppliers and growers and other donors to provide food through their 60,000 food pantries, soup kitchens, and other programs to the people and communities who need them. And so, like I said, before the pandemic, we were estimating that it was about 1 in 7 Americans who were utilizing our services, but we do expect that number has gone up this year. Next, I'm going to dive a little bit into what food insecurity is. If you notice in our mission, and if you see any materials in the public right now, you'll hear the word hunger a lot. And so I want to start on the next slide by actually talking about the difference between hunger and food insecurity. Hunger is really an individual level physiological condition, that can result from food insecurity. But really, when you try to compare hunger across the population, it's almost impossible. So the hunger that I may be experiencing, during the day just really can't be compared to another person. And it can't be measured in a survey in the same way that food insecurity does. On the next slide, I've got a definition of food insecurity. Fortunately, the USDA has developed a validated measure that does allow us to measure this and study it. So food insecurity is defined as the limited or uncertain access to enough food for all members of a household to live an active and healthy lifestyle. On to the next slide, there's a number of different tools that can be used to measure food insecurity. At the national level, the USDA tends to measure it through a rigorous 18-item scale with questions that range from things like, we worried whether our food would run out before we got money to buy more, to much more severe situations, such as in the last 12 months, did you or other adults in your household ever not eat for a whole day because there wasn't enough money for food? I want to mention one important note about the measure of food insecurity is that it really comes down to financial resources to be able to get food. So it doesn't measure the situation where you might not have enough time or you're too busy to get food, but it's really about not having enough financial resources to procure that food. So this is how the questions are asked about food insecurity. On the next slide, I've got more about the continuum of food insecurity. So depending on the number of questions that a household or a respondent might affirm to, their status is measured across 4 domains here, from high food security down to very low food security. So most typically we combine those into food secure and food insecure to look at it dichotomously. I want to talk just briefly about some of the drivers of food insecurity. On the next slide, the measure has existed for over 25 years now, so that means that there's been a lot of research that has been done. Unfortunately, especially in the past decade or so, there's been a growing increase in this space looking at the intersections of food insecurity and health and other factors. So I want to just touch on a few of the drivers that we know to be associated with food insecurity. Food insecurity is associated with having lower income, experiencing income shocks, being unemployed, having lower median income. People who have fewer financial assets and fewer financial management skills are more likely to experience food insecurity. People who face high living costs, whether that be utility bills, medical bills, rent bills, higher costs of food where they live, or other relocation issues are more likely to experience food insecurity. And then people who live in communities where the supports are not in place, such as transportation and other conditions that allow people to easily access food, can increase food insecurity. There's also a number of household characteristics that are associated, such as having a member in the household who's disabled, having a household that's led by a single female especially, but also by a single male, having a member who's a veteran of a recent war or who's been incarcerated are just some examples of households that are more vulnerable to food insecurity. And then on the flip side, there's a number of different consequences, as shown on the next slide, in terms of what people can experience as a result of food insecurity. And so this ranges from a child's ability to learn or focus in school to other mental, social, behavioral issues that can result. So that covers a lot of the background that I wanted to cover. And so next I wanted to get into who's food insecure, how many people are food insecure, and where they live. So as I mentioned, the USDA publishes an annual report. The latest came out just about a month ago and showed that 35 million people in 2019 were living in food insecure households. So this was before the pandemic. This is the last set of data we have from prior to COVID-19. And on the next slide, you'll see there's about 10.7 million children who are living in food insecure households. So both really high numbers. Way too many people are experiencing this even before the pandemic. But as the slide after this shows, we'd actually reached the lowest rates of food insecurity in 2019 in really over 20 years. So just as we were about to celebrate tremendous progress that had been made, especially in the wake of the Great Recession, a lot of that progress has been wiped out with the emerging pandemic. As Dr. Snelling mentioned, food insecurity is experienced across communities, but it doesn't affect every community equally. On the next slide, I've got a graph from the USDA's report that depicts this a little bit. There's certainly different racial and ethnic groups that are disproportionately experiencing food insecurity. So you can see here, the graph breaks out only a few of those populations, just given how the data is obtained. And so Native African Americans and Latinos there are the blue and orange line at the top. Two of the groups that disproportionately experiencing, but also not shown here, are Native Americans and some Asian subgroups who also face hunger at greater rates than other populations. On to the next slide. As I mentioned, food insecurity has existed before the pandemic and in every county in the United States. Feeding America has produced and conducted a study every year for the past decade called Map the Meal Gap, where we take that data from the USDA and drill it down to the county level. We use a regression model because there isn't information from the USDA's study available to speak to this at every county level, but we use data based on those drivers that I talked about to model what food insecurity looks like at the local level. So every county has some level of food insecurity. It varies across the county. The darker shades are where food insecurity is more prevalent. And you can probably notice some of the places in the map where those colors really pop. There's a lot of Native American reservations, a lot of communities in the South, and a lot of counties and communities where there's a higher proportion of residents who are people of color. On the next slide, let's see, catch up here. I'm going to move next into talking a little bit about how COVID-19 has impacted food insecurity. The rates were too high to begin with, but in the wake of the pandemic, we're certainly seeing a crisis emerge. And before I get started, I want to kind of acknowledge that the coronavirus has really proven to be what we've been talking about as this perfect storm. So there's a public health crisis kind of competing with this emerging economic crisis. And so when we talk about food insecurity and how it's caused by things like unemployment and poverty, want to be careful with the tension that exists with protecting the public health in the wake of this virus that is spreading, while also realizing that that's causing this economic crisis. And it's really a difficult tension and a line to walk in terms of whether communities should be open to allow jobs to resume versus closures to protect the public health. And so the bottom line is that a lot of the people that we are serving and that are facing hunger, visiting food banks, using federal programs, are at risk for both of these crises. They may have compromised immune systems, have limited healthcare access, and so they're at risk for this virus. They're also likely working in jobs that are public facing and more likely to face exposure, but they're also dealing with a lot of these economic issues. So just wanted to kind of preface that before I get into some of these details. On the next slide, I think if you read the news at all, you know that unemployment has kind of been the story of the summer, of the spring and summer, and still at this point from the economic side of things. When the pandemic really began to hit the US in March, unemployment soared in the weeks and months to follow, really shattering every record since unemployment was really begun to be measured in the 40s. And so these are two graphs that sort of show that. The one on the left just shows how much unemployment spiked initially in April. The one on the right was a visual that we've been referencing from the Wall Street Journal, which I think is interesting and shows how unemployment is also not affecting everyone evenly. It's real hard to see here, but basically it shows this is employment versus unemployment. So you can see these dips in unemployment that happened and the bounce backs that have happened in recent months. But some populations like African Americans, Latinos, people without an education are really struggling to recover, as well as some other populations. On the next slide, I want to talk a little bit about some work that Feeding America has done to project how food insecurity may be increasing in 2020. I mentioned our study Map the Meal Gap that uses this model to estimate food insecurity at the local level. When we release that study every year, it's often 2 years behind in a sense. The data, just with the speed required or the effort required to release that, by the time we're able to produce that study in 2020, we were looking at data from 2018. And so it was a little obsolete to be talking about data from 2018 when that study was coming out. And so we actually were able to use the model and input what we were suspecting is happening with some of those variables to predict what could be happening to food insecurity right now. So we've been specifically looking at poverty and unemployment and projecting what those rates might look like across the year. And so we released our first set of projections earlier this year between March and May, and we're estimating that as many as 1 in 6 people, including 1 in 4 children, may be food insecure in 2020. I've shown a graph that we created that shows the historical trends of those populations with some of the scenarios. And up until this point, we've been focusing on scenario C that suggested up to 54 million people this year may be facing hunger. We are actually in the process of revising those right now, but that's the latest that we've been focused on. On the next slide, I've got a few resources related to this in case you're curious in seeing how this differs across the country. We have all of this data down to the county level, similar to Map the Meal Gap. So we've got an interactive map. I've included a screenshot to the right, but we've also written up a number of briefs. I've got a link to the interactive map. And in case anyone on this call is kind of in the statistics world, whether it be for a school project or other effort, we also have a data set that's available for analysis, and we've gotten hundreds of people requesting that because food insecurity has certainly been an issue of great interest this year. So as I mentioned, we're actually right now in the process of revising those projections and are coming out with some slightly altered ones based off of more current unemployment and poverty data that we're going to be releasing in about 2 or 3 weeks here. But so far we've got everything still posted to our website. Moving on, I want to cover next the charitable response. And I thought I would start with a photograph on the next slide that I think speaks in a way to what we've been dealing with across our network. So this is a photograph of a food distribution of one of our member food banks in San Antonio that was happening, I believe, around April. And if you can't tell, this is an aerial shot of cars lined up to receive charitable food. And even looking at this right now, I've seen this picture hundreds of times, but it kind of moves me to speak to the magnitude of the need that's been happening. You know, we've served a lot of people even before, but I think the need and the way that people are showing up presenting that need has just been tremendous in recent months. And so our food banks have really been turned upside down in their efforts to try to meet this crisis. Providing more food and doing it really in some innovative ways. And so, you know, the charitable food response was often a very communal experience. Often people waited in line, would go through and pick their food in many cases. And obviously all of the conditions of the crisis are making that something that's particularly challenging. But at the same time, I think there's also a number of different opportunities that are arising through this crisis, and people are really kind of stepping up to the plate to try to meet that need. So I want to talk through a few of those somewhat quickly here, just in terms of what we're seeing and what those opportunities are. So I'm going to start with food supply and then kind of work my way clockwise quickly through each of these. The food supply chain has certainly been a challenge and an opportunity. Feeding America is estimating that we're going to be facing about a 10 billion pound food gap over the next year in terms of the difference between food we're expecting to come through our system and the need that we're expecting to see in terms of those lines. So that's not insignificant at all. And unfortunately, the supply chain has been affected in a variety of different ways, from increasing food costs to shortages because of the ways that people are shopping and, you know, emptying out stores in order to have enough food in their homes, and the strain that's putting on retail donations, to even supply chains being affected by outbreaks from, you know, meat packing plants and other locations that have had to close and disrupted the food chain. Volunteers are both an inspiration and a challenge. Our network has historically relied on volunteers for a lot of our operations, many of them older, and older people, as we all know, are affected by the virus disproportionately as well. So it's been a challenge losing those volunteers or encouraging them to stay home and then finding people to fill those gaps when there's you know, danger almost in volunteering in some ways. So that's a challenge going forward. Government is always probably more of a challenge than an opportunity, but I do want to acknowledge that the government response to this crisis has been pretty remarkable. Some of the bills that emerged in the spring, you know, have certainly helped to mitigate some of the need, and between the unemployment benefits and the additions to SNAP, but there's always more opportunity, and the need is not going away. And so there's a lot more that's going to need to be done there. Program delivery, as I kind of mentioned, a lot of the typical ways that we've operated have been limited by the virus and the closures that are happening. And so food banks have had to find new and creative ways to still operate, largely through mobile distributions and through home delivery. And I do think that this is one really exciting opportunity, because I think we've always kind of done things the way we've done them, and COVID has forced people to move outside of that box. And I have excitement about the future in terms of how we can do better in bringing food to people or meeting people where they're at rather than requiring people to show up at our door and wait in line. Another challenge are competing disasters, which I think we expected would happen, but between the fires and hurricanes and tornadoes that have emerged in recent weeks and months, you know, we're dealing with a pandemic, and then on top of that are also dealing with these kind of regional disasters, which are certainly a challenge. And then finally, public support. I think we've all been overwhelmed by the ways that individuals and organizations have stepped up to support the anti-hunger movement. It's been really humbling, but also this is not a short crisis that we're facing, and so there's also some concern for fatigue and whether people are going to continue to come out to support anti-hunger programs and the people who are facing hunger going forward. So that is what I have in terms of challenges and opportunities, and then want to wrap it up with a few calls to action. So I've narrowed it down to just 4 here. There's probably more ways that I could invite you to join this fight, but I'll stick to these. And I'm going to start with one that I'm sure everyone's hearing from all directions, but vote. Register to vote. Encourage your friends to register to vote. I think this is a remarkable year for this to be happening on the heels of an election, and you know, it's important to elect an administration that will support anti-hunger programs and the people who are experiencing hunger. So I've got a link in all of these words here where you can find more information through our website, but please vote. Along those lines, there's a number of different ways to advocate for federal nutrition programs. I know Johanna is going to talk about those a little bit more, but there's all sorts of ways that you can urge your local legislators to support different programs that are really going to help people who are facing need right now. Additionally, you can support your local food bank. I mentioned we have 200 of them. I've included a link where you can find what your local food bank is, and there's all sorts of ways you can support them, between volunteering, between donating, between just getting the word out about the need in your own community. And then finally, you can give or encourage others to give. I know being in grad school maybe makes the former a little bit more difficult, but there's all sorts of ways that you can start fundraisers or encourage others to contribute to all the work amazing work that's going on, either through our organization, through our local food banks, or through other partners who are part of this fight. So I feel like I sped through a lot of that, but really appreciate the opportunity to be here. So I've included my information, and I'll pass it along now to Johanna to take it from here.
Yeah, thanks, Monica. That was great. I'm going to start by just giving a quick introduction of who No Kid Hungry is and what we do, and then talk about some of the challenges and also solutions that we're seeing in the field, and some of the policy opportunities as well. So No Kid Hungry is a national campaign of the anti-hunger organization Share Our Strength. We work in all 50 states, but have boots on the ground in about 7 of them. And our work is really focused on the federal nutrition programs. So what that looks like on the day-to-day is school breakfast, school lunch, after school meals, summer meals, the programs that there are federal reimbursements available, so that they are kind of a sustainable way that we can feed kids in the community. So that's what we do all year round. Things have looked a lot different since the pandemic hit in March. We've kind of all shuffled our focus to be all hands on deck, and have granted upwards of $27 million to schools and community organizations to help them really adapt their programs to meet the need, and just like serve kids and families under really unprecedented safety circumstances as well. And with many children doing remote learning, the school meal programs have had to really adapt to look a lot different. So we're also working to provide consultation and technical assistance to schools to work within the existing rules and regulations, and allow them to meet the need, both in terms of reaching kids and being able to provide enough food. Really focused heavily on advocating at both the state and federal level for additional funding and for changes to policies around the programs that allow them to meet the current level of need. Monica really did an amazing job of laying out the scope of childhood hunger and food insecurity. I want to just say that my lexicon, I say childhood hunger, I am talking about food insecurity too. But childhood hunger, it was definitely a problem in the United States, as you saw before the coronavirus pandemic, and the economic crisis that has come alongside the health crisis has made it even harder for families to put food on the table. There are so many different estimates of what this looks like now and what it's going to look like in the coming months and years. But the thing that just always strikes me, and I just have to drive home, is that we truly have seen, almost all the models agree, that in the last 6 months alone have undone a decade's worth of progress in ending childhood. Next slide. This summer, No Kid Hungry released a new research-driven report, and hopefully we can provide. Oh, slide before. Well, it doesn't matter. They're both good. So the longest summer report, Childhood Hunger in the Wake of the Coronavirus, and it gives insights into the pandemic's impact on kids and families, and kind of some of the coping mechanisms that they're using. So just a little bit about how we did it, working with a research firm. No Kid Hungry conducted 2 national surveys, as well as a series of video diaries that are really powerful. I recommend watching those as well, to capture the stories of families from across the country. So we surveyed a little over 1,150 adults to understand changing ideas about both perceptions of childhood hunger, but also the programs in place to alleviate it. And we also spoke with just about 1,250 parents of children aged 5 to 17 to understand what they're facing. So what we found was that nearly half of the American families that we spoke with are currently living with food insecurity in some form during the pandemic. And I just think, once again, what's really distressing about this is just how quickly food insecurity skyrocketed when COVID hit. Monica talked about the USDA numbers that came out in September, and just recognizing that when those came out, they cover through 2019 before the pandemic hit. But we were seeing the lowest rates of food insecurity on record since they began tracking it in 1998. And they were nearly half the number at the height of the Great Recession. So it's just really striking how quickly and how devastating it has been, as millions of Americans have lost jobs and wages. And I think, like, for some, some are experiencing this for the first time, and others who are already experiencing food insecurity, it's really been intensified, and is a really much bleaker picture now. So we're looking at a really different picture than we were, and according to recent estimates, anywhere between 9 and 17 million children are not getting enough to eat on a daily basis. Next slide. This is a quote from one of the parents we spoke with as part of the longest summer report. And I think what it really drives home is the sacrifices families are having to make. So food insecurity may not mean that every child in the household is missing a meal, but in a lot of instances, parents are making some sacrifices. Half of the parents we talked to are reporting skipping meals so that their kids can eat. 2/3 talked about making meals with limited options or potentially not what they would have used otherwise. And 40% said that they had to skip another bill, like the utility bill, rent, in order to buy groceries. So that's a really big trade-off to make that has other devastating impacts. Next slide, please. So some of the other major findings from our research, I think it goes without saying that the health crisis has been accompanied by an enormous, you can hear one of my pit bulls in the background that I talked about, that's loud, has been accompanied by an enormous economic crisis. More than half of working parents we talked with reported losing their jobs or having their hours cut. And I think what's also important add here is that many of the families being hit the hardest that are facing food insecurity also have one or more parents who are working as essential workers or in industries where they have to go in every day and expose themselves to illness. So it's really compounded. A couple of bright points I want to mention that we found through this research is that I don't know whether it's because, the issue is so front and center, or just the more widespread hunger is impacting people, but we are seeing more widespread acceptance and potentially even a little less stigma around the federal nutrition programs. So we found that public support for both school meals and SNAP is higher than before the crisis, and most Americans now support increased federal funding for safety net programs. Next slide, please. I want to talk about hunger not in a silo, but how it is impacting both short and long-term impacts on children and on our communities. I think it's interesting, especially right now in an election year, when you poll Americans on what issues matter most, hunger hasn't traditionally been in the top 5, but hunger is intrinsically connected to nearly every issue we see on the top of folks' minds. So it's connected to the economy, it's connected to health, it's connected to our education system. And this is really just a couple of examples here, but children who are hungry don't perform as well on tests. They are more likely to experience what we call chronic absenteeism, where they're missing many, many days of school. They're less likely to graduate high school. They experience health problems both in childhood, so asthma, throughout their life. So heart attacks, strokes, long-term health impacts. And through these factors and many more, researchers have estimated that the cost of hunger on our US economy is more than $167 billion a year. Next slide, please. Hunger is also a racial equity issue. I want to be really upfront here. Systemic racism is at the heart of many children's experience with hunger. Many Black and Brown children face steep disadvantages in the classroom, at home, in their communities as a result of systemic racism over decades and centuries. So this isn't new, but the crisis has really deepened those disparities, and frankly just made them more visible. The graph here shows trends over time in household food insecurity by race, but we know that communities of color have been hit disproportionately hard by the coronavirus from a health standpoint as well as an economic one. According to the census during COVID-19, rates of food insecurity among Black households with children are nearly twice as high as they are among white households with children, and the rates for Hispanic respondents were about 60% higher than for white families with children. And just going back to the last slide, I mean, you don't have to go back, but connecting to what I was talking about on the last slide around the lifelong impact on health, on education, I just want to also point out that these inequities are really compounded over many factors over many years. You can go to the next slide. So I think we've talked a lot about the challenges that we're up against, and they do feel big. They feel, it's an immensely challenging time we're in, but I still very much feel like childhood hunger is a solvable problem and that we have solutions that we know that work. So with the next slide, I will start talking about some of those. First off, school meals. I think I mentioned school meals is really No Kid Hungry's bread and butter. For the past decade, we launched the No Kid Hungry campaign in 2010, and we have been working really closely with school districts, so big school districts, around changing how they operate the meal programs. For example, offering breakfast in the classroom so it's reaching more kids, summer meals, and continue to be really focused here during this pandemic. 22 million kids were eligible for free and reduced price meals last year, but with what we've seen around the number of families who are pushed into poverty and hunger as a result of this crisis, more kids are going to rely on the meals next year. or I should say this school year, because we're already in it. And I think, amidst the increased need, it's also a really uncertain school year as districts are trying to figure out still, are we operating remotely? Are we operating in person? Is it some sort of hybrid model? And regardless of which of these we're doing, how are we making sure that kids are fed? And it's meaning that they're having to really adapt their programs and find ways to feed kids in the classroom, but safely. So social distancing, but also kids who are learning from home or virtually somewhere else. So it's a really important source of nutrition for kids. In fact, like if kids are participating in both breakfast and lunch, it's up to 50% of the energy intake they get each day. But it's also a really important lifeline for families who are trying to make ends meet in making, especially these times, their budget able to continue to buy groceries while also paying the bills, while also paying any unexpected health needs that come up right now. I also think it's an important, in terms of creating a sense of normalcy for students. It's something that they can recognize from school. At school meals they recognize, and maybe even though they're not learning in the classroom with their peers, they're eating the same thing for lunch, and that's a point of connection. And lastly, again, I can't drive this home enough, but school meals are a matter of equity. We are seeing at the same time, we are seeing a lot of stories of kids struggling with distance learning because they don't have access to a computer or high-speed internet at home. There's stories from all across the country. I read a story of kids who were learning in a Taco Bell parking lot to have access to the Wi-Fi. And the reality is that many of the students struggling with digital connection are the same students whose families are facing food insecurity. And combined, those are two really big factors in determining how kids are going to do in school this year, because they can't learn without being able to log into their classes, but they also can't learn without nutrition. You can't think, you can't focus. So those are two huge factors. Going on to the next slide. These are pictures from a number of the programs that we have been working closely with since COVID hit. And this really, I find this very inspiring and a point of a bright spot amidst all this. When schools closed in March, pretty much in I think every district in the country closed at least at some point. School nutrition teams and the community organizations in the communities really stepped up to make sure that kids were continuing to get the meals they need while keeping the staff and the family and the students safe. And they got incredibly innovative in how they served meals, how they delivered meals. They established new purposes for their equipment, for their vehicles, and new partnerships in the community. I'll give a couple examples. You see the school buses here, but one thing we saw in a lot of school districts is that they were redeploying their buses as mobile meal delivery units. They were no longer picking up kids and bringing them to school. So instead, they're bringing the meals to either homes or to a central location that kids can access. One food bank we work with, actually, they typically have to drive a 6-hour delivery route to provide meals to their most rural community. It's 6 hours. So they were only able to deliver meals once a day. So they had to get creative and package these freeze and thaw meals where they could provide reimbursable meals for kids for the entire week that families could then thaw and heat up and serve each day. We also saw just really innovative partnerships with for example, with struggling restaurants in the community that maybe their space wasn't being used and their staff didn't have a role, to repurpose them to participate and help with actually some of the supply chain to do meals for kids and get those meals prepared and served in communities. So I think it's just really inspiring to see some of these innovations that have happened in these challenging times. And I completely agree that I think that some of these are going to be things that stay with us and show that they worked. We saw that this can be done and that it was successful. and that even once whatever normal looks like when we go back to it, some of this will still stay with us. Next slide, please. So the last piece I wanted to talk about is some of the policy solutions that we're really focused on, because I think it's needless to say that amidst the unprecedented level of need, we need a multi-tiered approach here, right? Like we need the existing nutrition programs like SNAP, like pandemic EBT, like school meals, at the same time that we need charitable and emergency feeding, food pantries. We need all of these working together to ensure that equitable access to food that kids need to succeed. The school nutrition programs, I talked a little bit about how they adapted, but the reason they were able to do this was really important waivers that they got from the USDA that allowed community organizations and schools to actually use the summer meals program, which is more flexible, to feed kids without the same paperwork and enrollment, to feed younger siblings. And this was critical when schools closed in March. It currently has been extended through the end of December. The CR that passed the Senate yesterday gave explicit authority to the USDA to extend it through the full school year, but we still need them to do that. And then I also want to say that one of the most, we work most directly on school meals, but one of the most effective, efficient ways to feed kids is to make sure that their families can afford to buy groceries. During the pandemic, a new short-term benefit called Pandemic EBT was made available. This essentially, when schools close and kids are not getting the meals from school, this provides families that were enrolled in free and reduced price lunch the cost of breakfast and lunch on an EBT card that they can use to purchase groceries. That made a really big difference. Right now, again, that was extended in the CR that passed. My understanding is that state agencies across the country are still going to have to apply to offer it in their states, and there's a lot of outreach left to be done to make sure families know they're eligible. And then the last program, the Supplemental Nutrition Assistance Program, previously known as food stamps. This is a huge lifeline for kids and for families. Always, especially now, the benefits are too low and the need is just far too vast. We are advocating for a temporary increase to the maximum SNAP benefit by at least 15% and increasing the minimum benefit from $16 to $30 for all SNAP households. In terms of where that's at, a bill was the HEROES Act was introduced in the House that did include important SNAP provisions, as well as really critical funding for school nutrition programs that are struggling right now. It, I think, faces a fairly uphill battle in the Senate, but we will see, and that is an important place that we can weigh in with our senators next week if they take up that bill. So we've seen some really big wins already in terms of getting the waivers extended, PEBT extended, but I do think that there's still some more work to be done. You can go to the next slide. It's just me saying thank you for joining us today and for being this. There are a lot of challenges right now, but feeding kids, feeding families, making sure that everyone has enough to eat feels like a really important one. So I just want to say thank you so much for having us and for everybody who's tuning in and is taking interest in the issue.
Great. Thank you so much. It really did a great job. I have all these questions, and yet you're like, oh, you answered that one and you answered that one. So you did a great job, Monica and Johanna. I'm going to go to the attendees' questions in just a moment, but I do have one question that is more just, I guess, how you get your message out. I'm thinking about all the messages that want headline news, and I'm wondering what strategies your organizations use to really communicate these very pressing issues. Obviously I'm in this space, so I think food equity is really important and should get headline news all the time, but we are competing with a lot of other things. So I'm wondering how your Share Our Strength or Feeding America goes about communicating this information to the general public to get your message out and heard so that it's acted upon?
Yeah. I'm on our communications team, so I think about this all the time. And I can't agree with you enough that, breaking through right now is hard.
Right.
There's a lot of issues at the forefront. I have to say, one of the things that has been very promising for me is the increased interest we've seen in the issue. I think that we have seen both partner organizations and media, frankly, coming to us in a way that, they see photos like the one that Monica shared, and that is a appealing interest story. So I think that part of it is just, this has become so widespread that it is undeniable, and people are seeing it in their communities, and that is making it kind of at the forefront of people's minds. The other piece that I'm really focused on through our work in the States is, the other bucket is awareness for families who are eligible to participate in these programs. Right. So getting the word out, especially, God, when you have natural disasters and you have disaster SNAP, when you have pandemic EBT, when you have school meals programs that, because the waivers are extended at the last minute, have to change how their programs work back and forth. It has taken a lot of direct to family marketing to get the word out, and that's not something that I have traditionally done in my role, but it is certainly something, since this has been at the forefront, that has been front and center.
Monica, go ahead.
Yeah, I was definitely just going to agree. I think I like the way that Johanna had framed up how hunger historically had been an issue where we had to get creative in attaching it to what was relevant and going on in the world. And for better, but mostly for worse, right now we're in the position where people are coming to us. I'm not on our communications team, but work closely with them. And I know that they have reporters kind of at the ready for whenever we have something new. And so it's really us more trying to provide enough information and fill those interest stories, because it's just remarkable how hunger and related issues are just so widespread, so affecting every community. And there's benefits to kind of that normalization, or like the empathy that's going on for it right now compared to other times, because this is really kind of a universal experience that everyone's feeling, but definitely lots of challenges kind of associated with that as well.
Great, thanks. Kat, any questions from the team here?
Nothing yet. I think Johanna and Monica have done such a good job presenting. No questions on my end.
Well, then I'm going to go to my other question, which really has to do with the long view of this. Right now we are thick into it, and I'm sure both of your organizations also believe that we can't even consider recovering because we're still in such a thick action stage of addressing it. But I am wondering, I'm sure you have people who are strategizing, because even once the pandemic ends, we certainly know economists say that some jobs are not coming back and others will be very slow. So I do worry about, and I'm sure people are up longer than I in the night, thinking about how long food insecurity could go on long after the pandemic is in our rearview mirror. So I'm wondering, what Feeding America or Share Our Strength are thinking about for the long game of this, as it's going to go on for long after 2021.
We're definitely trying to think about it. I think compared to, other crises or challenges in the past, and the Great Recession is sort of the easy one to look back to. I think comparatively that time seemed more predictable, and there's just so much that is not known about this, and the path that the virus is taking, and how local economies and leaders are going to react to this. And so some of it is not being able to, it's kind of a crystal ball situation, trying to predict what the need's going to look like into the future. At the same time, we can use that historical context to show that it took almost a decade for the Great Recession, the heights of the Great Recession, to come back down. And there's no reason to think that this isn't going to be a similar situation where many people are going to be struggling. Even during that time, you know, this crisis has hit so much more quickly. That one took a little bit more time to set in. But I would expect that there's just going to be long-term need in a similar way, that people are struggling this year, but it's going to go on into the years to come. And so I think it is really balancing the need right now with also kind of bracing for like that fatigue I was talking about, where we're not going away. We're here for the long haul, but we're hoping that people who support us and are kind of in this fight with us from multiple layers will recognize that, and this won't be something that'll just be a 2020 focus issue that we'll be fighting by ourselves with Share Our Strength and other partners, you know, in the time to come.
Yeah, I think it's on all of our minds, whether once, you know, it's not at the forefront, the support is going to be sustained. And I think that that's really why, you know, I also strongly believe that the communities who have been hit the hardest are going to unfortunately be the last to come back and going to need the most support. And I think that this also speaks to, you know, not to beat a drum, beat the drum, not to beat a dead horse. I think, you know, this is why the federal nutrition programs matter, because they can expand and constrict to meet the need. And right now we're seeing unprecedented need, and we need them to grow to meet that. And if, you know, we've done it before, and like Monica said, in the decade after the Great Recession, there's no reason we can't do it again, but it is going to need both, you know, the innovation and that we're seeing at the community level, partnered with generosity, partnered with federal nutrition programs.
Well, I think it's probably getting to the top of the hour, so let me just thank you so much, because I think I know I can't speak for the attendees, but it's been inspirational. And, you know, it's wonderful to be speaking to people who are coming up through graduate and undergraduate, and you're inspiring this next generation to get involved and stay engaged, and to be involved with social issues like this that are so very important. So thank you so much for your time and all of your knowledge. It's really been a great session. So hand it back over to Kat.
Hi, everyone. Thank you. I agree so much. Thank you so much, Johanna and Monica. For our prospective students that are here with us today, here are the admission requirements. So you have that. Please feel free to call us, email us with any questions about our Masters of Science in Nutrition Education program. For last but not least, as promised, our next program webinar, we wanted to let you know first. This will be featuring Margot Wooten, a leading food and nutrition advocate who has been recognized by the Harvard School of Public Health for leadership in public policy, and also named as one of the most innovative women in food and drink by Fortune magazine. Should be an excellent session, and we hope you all can join us. And thank you all so much. This concludes the presentation. Again, thank you, Dr. Snelling, Johanna, and Monica. We really appreciate your time, and we look forward to seeing you all at the end of this month.
Thank you.